Section 12. Sleep Disorders. 1. Which of the following is a function of sleep? A. Restores nutrients to the body. B. Helps us to function optimally the next day. C. Reduces energy level. D. Diminishes the awareness of our surroundings. The correct answer is B. Helps us to function optimally the next day. 2. Which of the following is a sleep disorder? A. Breath-related sleep. B. Chronic sleep disorder. C. Primary breath-related disorder. D. All of the above. The correct answer is A. Breath-related sleep. 3. Which of the following medical conditions can cause sleep disorder? A. Parkinson's disease. B. Huntington's disease. C. Brain disease. D. All of the above. The correct answer is D. All of the above. 4. Which of the following psychiatric conditions disorders are the most common cause of chronic insomnia? A. Histrionic personality disorder. B. Bulimia nervosa. C. Somatoform disorder. D. Depression. The correct answer is D. Depression. 5. Which of the following substances can disrupt sleep? A. Alcohol. B. Caffeine. C. Antihistamines. D. All of the above. The correct answer is D. All of the above. 6. There are blank stages of sleep. A3, B4, C5, D6. The correct answer is C5. 7. Stage 1 accounts for approximately blank of an adult's total sleep. A. 5%, B. 10%, C. 20%, D. 30%. The correct answer is A. 5%. 8. The lightest stage of sleep is stage blank. A. Stage 1, B. Stage 2, C. Stage 3, D. Stage 4. The correct answer is A. Stage 1. 9. Which of the following has spike-like wave with low-medium amplitude occurring 3 to 7 times per second? A. Beta waves. B. Sleep waves. C. Theta waves. D. None of the above. The correct answer is C. Theta waves. 10. Stage 2 comprises of approximately blank of total sleep time. A. 20%, B. 30%, C. 40%, D. 50%. The correct answer is D. 50%. 11. Which of the following is the deepest stage of sleep? A. Stage 1, B. Stage 2, C. Stage 3, D. Stage 5. The correct answer is C. Stage 3. 12. Which of the following is a large wave of slow high amplitude and low frequency? A. Beta waves. B. Delta waves. C. Theta waves. D. Sleep waves. The correct answer is B. Delta waves. 13. In which of the following stages does the delta waves account for less than 50% of brain waves? A. Stage 3, B. Stage 4, C. Stage 5, D. Stage 6. The correct answer is A. Stage 3. 14. In which of the following stages does the delta waves account for more than 50% of the brain waves? A. Stage 3, B. Stage 4, C. Stage 5, D. Stage 6. The correct answer is B. Stage 4. 15. Arousing a sleeper from which of the following stage is the hardest? A. Stage 1, B. Stage 2, C. Stage 3, D. Stage 6. The correct answer is C. Stage 3. 16. Stage 5 sleep is called blank. A. K complexes. B. Rapid eye movement. C. Sleep spindle. D. Delta waves. The correct answer is B. Rapid eye movement. 17. Rapid eye movement sleep usually occurs blank after sleep onset. A. 10 minutes. B. 30 minutes. C. 40 minutes. D. 90 minutes. The correct answer is D. 90 minutes. 18. Rapid eye movement accounts for about blank of total sleep time. A. 10%, B. 20%, C. 50%, D. 80%. The correct answer is B. 20%. 19. Most story-like dreams take place during blank. A. Stage 2, B. Stage 3, C. Stage 4, D. Stage 5. The correct answer is D. Stage 5. 20. Which of the following stages of sleep may stimulate brain growth? A. Stage 2, B. Stage 3, C. Rapid eye movement sleep, D. Stage 1. The correct answer is C. Rapid eye movement sleep. 21. The REM sleep is controlled by two portions of the brain, one of which is the blank. A. Pons, B. Frontal lobe, C. Medulla, D. Parietal lobe. The correct answer is A. Pons. 22. Which of the following controls the NREM sleep? A. The midbrain, B. The basal forebrain, C. The medulla, D. The brainstem. The correct answer is B. The basal forebrain. 23. Which of the following factors affects sleep quality? A. Lifestyle, B. Sleep environment, C. Medication, D. All of the above. The correct answer is D. All of the above. 24. Pre-adolescents need about blank of sleep. A. 8 hours, B. 10 hours, C. 12 hours, D. 14 hours. The correct answer is B. 10 hours. 25. A typical young adult needs about blank of sleep. A. 5 hours, B. 8 hours, C. 15 hours, D. 20 hours. The correct answer is B. 8 hours. 26. Which of the following is the most important symptom of sleep disturbance? A. Insomnia, B. Drowsiness, C. Anxiety, D. All of the above. The correct answer is A. Insomnia. 27. Which of the following is the most common breathing-related sleep disorder? A. Obstructive sleep apnea syndrome, B. PCP syndrome, C. Airway obstruction syndrome, D. Central sleep apnea. The correct answer is A. Obstructive sleep apnea syndrome. 28. Repetitive cycles of snoring, airway collapse, and arousal may lead to which of the following? A. High blood pressure, B. Stroke, C. Myocardial infarction, D. All of the above. The correct answer is D. All of the above. 29. Obstructive sleep apnea syndrome approximately affects blank of the population. A. 3%, B. 10%, C. 20%, D. 30%. The correct answer is A. 3%. 30. Incidence of obstructive sleep apnea syndrome rises especially after age blank. A. 10, B. 20, C. 50, D. 70. The correct answer is C. 50. 31. Which of the following is true about obstructive sleep apnea syndrome? A. Most patients are overweight with short, thick neck and fat infiltrated around the pharynx. B. It affects more females than males. C. Menopause is a significant precipitating factor in women. D. All of the above. The correct answer is D. All of the above. 32. Which of the following is a complaint of patients with obstructive sleep apnea syndrome? A. Frequent headaches, B. Irritability, C. Impotence, D. All of the above. The correct answer is D. All of the above. 33. Which of the following is a type of treatment for obstructive sleep apnea syndrome? A. Lifestyle changes. B. Psychotherapy. C. Drug therapy. D. Relaxation therapy. The correct answer is A. Lifestyle changes. 34. Which of the following may reduce apneic episodes? A. Sleeping on the back. B. Sleeping on the side. C. Sleeping at night. D. Sleeping in the day. The correct answer is B. Sleeping on the side. 35. Which of the following is the most common and effective treatment for obstructive sleep apnea syndrome? A. Lifestyle changes. B. Polysomnography. C. Continuous positive airway pressure therapy. D. Weight loss. The correct answer is C. Continuous positive airway pressure therapy. 36. Blank is an overnight sleep study performed in a special laboratory or sleep center. A. Polysomnography. B. Sleep study. C. Sleep latency testing. D. Electrocardiography. The correct answer is A. Polysomnography. 37. Electrooculography determines when the patient is experiencing blank. A. Obstructive sleep apnea. B. Rapid eye movement. C. Sleep apnea. D. Insomnia. The correct answer is B. Rapid eye movement. 38. Muscle movement is measured by which of the following? A. Electrooculography. B. Polysomnography. C. Electromyography. D. Electrocardiography. The correct answer is C. Electromyography. 39. The blank alerts the technician to any emergency conditions. A. Electrocardiography. B. Electromyography. C. Polysomnography. D. Electrooculography. The correct answer is A. Electrocardiography. 40. The blank detects the amount of air moving in and out of the airways. A. Pulse oximeter. B. Thermistor. C. Velcro bands. D. Piezo crystal transducer. The correct answer is B. Thermistor. 41. The electrooculography along with the EEG helps to determine blank. A. The total sleep time. B. The arousal periods. C. Spastic movements. D. All of the above. The correct answer is A. The total sleep time. 42. Which of the following tests is used to determine whether any abnormal waves were caused by an actual arousal or normal movement in bed? A. Electrocardiography. B. Polysomnography. C. Multiple sleep latency test. D. None of the above. The correct answer is C. Multiple sleep latency test. 43. Which of the following is a surgical procedure used to correct obstructive sleep apnea syndrome? A. Uvulopalatoplasty. B. Correction of jaw abnormalities. C. Tonsil and adenoid removal. D. All of the above. The correct answer is D. All of the above. 44. Which of the following procedures has a high failure rate? A. Laser-assisted uvulopalatoplasty. B. Tonsil and adenoid abnormalities. C. Correction of jaw abnormalities. D. All of the above. The correct answer is D. All of the above. 45. In blank, the patient's internal sleep-awake pattern is out of sync with the demands of his work schedule. A. Circadian rhythm sleep disorder. B. Breath-related sleep disorder. C. Narcolepsy. D. Insomnia. The correct answer is A. Circadian rhythm sleep disorder. 46. The body's internal clock is regulated by blank. A. Circadian. B. Melatonin. C. Melanin. D. Oropharynx. The correct answer is B. Melatonin. 47. Which of the following is a type of circadian sleep disorder? A. Delayed sleep disorder. B. Jet lag sleep disorder. C. Shift work sleep disorders. D. All of the above. The correct answer is D. All of the above. 48. In blank, the patient sleeps according to a delayed clock time. A. Shift work sleep disorder. B. Jet lag sleep disorder. C. Delayed sleep disorder. D. Excessive sleep disorder. The correct answer is C. Delayed sleep disorder. 49. Jet lag often requires a recovery period of blank for every time zone passed over. A. 1 day. B. 2 days. C. 3 days. D. 4 days. The correct answer is A. 1 day. 50. A circadian rhythm disorder is diagnosed in blank of patients who complain of insomnia. A. 1 to 2%. B. 3 to 4%. C. 7 to 10%. D. 20 to 30%. The correct answer is C. 7 to 10%. 51. Patients with delayed sleep disorder may report which of the following? A. Inability to fall asleep before 2 a.m. to 6 a.m. B. Difficulty awakening in the morning. C. Feeling of being sleep deprived. D. All of the above. The correct answer is D. All of the above. 52. Blank involves manipulating the patient's sleep schedule by progressively delaying bedtime by 1 or more hours each night until the patient can go to sleep and wake up at appropriate times. A. Chronotherapy. B. Psychotherapy. C. Chronopharmacotherapy. D. Luminotherapy. The correct answer is A. Chronotherapy. 53. Blank is the use of bright light to manipulate the circadian system. A. Psychotherapy. B. Chronotherapy. C. Luminotherapy. D. Luminant therapy. The correct answer is C. Luminotherapy. 54. Blank involves the use of drugs to induce sleep or promote wakefulness when desired. A. Chronotherapy. B. Chronopharmacotherapy. C. Pharmacotherapy. D. Luminant therapy. The correct answer is B. Chronopharmacotherapy. 55. Which of the following is an appropriate nursing intervention for a patient with circadian rhythm disorder? A. Caution the patient about the dangers of using unapproved treatments. B. Inform patients that the melatonin isn't always produced under quality-controlled conditions. C. Review the required procedures with patient to promote his compliance with sleep intervention. D. All of the above. The correct answer is D. All of the above. 56. Blank is characterized by sudden, uncontrollable attacks of deep sleep lasting up to 20 minutes. A. Narcolepsy. B. Circadian rhythm disorder. C. Continuous positive airway disorder. D. Primary insomnia. The correct answer is A. Narcolepsy. 57. About 70% of patients with narcolepsy experience attacks of blank. A. Insomnia. B. Cataplexy. C. Hypnagogic hallucination. D. Sleep paralysis. The correct answer is B. Cataplexy. 58. Blank is the sudden loss of muscle tone and strength. A. Sleep paralysis. B. Hypnagogic paralysis. C. Cataplexy. D. Insomnia. The correct answer is C. Cataplexy. 59. Teenagers with narcolepsy are at increased risk of blank. A. Aggressiveness. B. Automobile accident. C. Drug abuse. D. All of the above. The correct answer is B. Automobile accident. 60. Which of the following is the most common cause of daytime sleepiness? A. Narcolepsy. B. Obstructive sleep apnea syndrome. C. Cataplexy. D. None of the above. The correct answer is B. Obstructive sleep apnea syndrome. 61. Which of the following is true about narcolepsy? A. It affects more males than females. B. It is the most common cause of daytime sleepiness. C. The usual onset is young adulthood. D. It doesn't occur in children. The correct answer is C. The usual onset is young adulthood. 62. Which of the following is a symptom of narcolepsy? A. Cataplexy. B. Excessive daytime sleepiness. C. Dreamlike hallucinations at sleep onset. D. All of the above. The correct answer is D. All of the above. 63. Blank is a condition of excessive sleepiness characterized by either prolonged sleep periods at night or daytime sleep episodes occurring nearly every day. A. Cataplexy. B. Primary hypersomnia. C. Sleep hypersomnia. D. Narcolepsy. The correct answer is B. Primary hypersomnia. 64. In the blank form, the patient has isolated excessive daytime sleepiness unrelated to abnormal nocturnal awakenings. A. Monosymptomatic. B. Polysymptomatic. C. Biosymptomatic. D. Multisymptomatic. The correct answer is A. Monosymptomatic. 65. The blank involves abnormally long nighttime sleep and signs of sleep drunkenness on awakening. A. Multisymptomatic. B. Monosymptomatic. C. Polysymptomatic. D. Biosymptomatic. The correct answer is C. Polysymptomatic. 66. Blank is a central nervous system stimulant that promotes wakefulness and alertness. A. Modafinil. B. Naloxone. D. Disulfiram. D. Diazepam. The correct answer is A. Modafinil. 67. A recurrent form of hypersomnia is called blank. A. Reverse melanin syndrome. B. Klein-Levin syndrome. C. Narcolepsy syndrome. D. Cataplexy syndrome. The correct answer is B. Klein-Levin syndrome. 68. Some patients with Klein-Levin syndrome experience which of the following symptoms? A. Hypersexuality. B. Irritability. C. Depersonalization. D. All of the above. The correct answer is D. All of the above. 69. All of the following is true about primary hypersomnia, except A. The prevalence in the general population is not known. B. It usually affects adolescents and young adults between age 15 and 30. C. In sleep disorder clinics, an estimated 40% are diagnosed with this disorder. D. During long periods of drowsiness, the patient may exhibit automatic behavior. The correct answer is C. In sleep disorder clinics, an estimated 40% are diagnosed with this disorder. 70. Blank is characterized by difficulty in falling asleep, sleeping too lightly, and frequent awakenings during the night. A. Primary insomnia. B. Primary hypersomnia. C. Sleep dysfunction. D. Narcolepsy. The correct answer is A. Primary insomnia. 71. With blank, the person may become preoccupied with getting enough sleep. A. Acute insomnia. B. Chronic insomnia. C. Hypersomnia. D. Secondary insomnia. The correct answer is B. Chronic insomnia. 72. Which of the following may be responsible for chronic insomnia? A. Anxiety. B. Caffeine. C. Alcohol. D. All of the above. The correct answer is D. All of the above. 73. Blank centers on the theory that insomnia represents a learned response to bedtime and bedroom cues. A. Stimulus control. B. Paradoxical intention. C. Biofeedback. D. Sleep restriction. The correct answer is A. Stimulus control. 74. Blank creates a mild state of sleep deprivation which promotes more rapid sleep onset and more efficient sleep. A. Biofeedback. B. Sleep limitation. C. Sleep restriction. D. Paradoxical intention. The correct answer is C. Sleep restriction. 75. Which of the following is a complementary therapy that may be used to treat insomnia? A. Acupuncture. B. Aromatherapy. C. Reflexology. D. All of the above. The correct answer is D. All of the above.